My name is Gianni Allais from the Women's Headache Center, Department of Surgical Sciences at the University of Turin in Italy. I would like to give you an overview of our article entitled Spotlight on Frovatriptan, a review of its efficacy in the treatment of migraine. Migraine is a common neurovascular disorder affecting millions of people worldwide and having a large economic impact on society. It affects women more than men in a ratio of 3:1, and in more than 50% of women suffering from migraine, there is an association with the menstrual cycle. This review article aims to provide an overview of the efficacy of the long-acting triptan, Frovatriptan, in the acute treatment of migraine in light of recent publications. Triptans form a group of selective serotonin 5-HT1 receptor agonists and are recommended as first-line therapy for moderate severe migraine attacks. Frovatriptan has a longer terminal elimination half-life in blood than other triptans, potentially making it a good option for those suffering with migraine recurrence. 3 direct comparative, double-blind, randomized crossover studies have assessed the efficacy and safety of Frovatriptan compared with that of rizatriptan, zolmitriptan, and almatriptan. The studies were conducted across 33 headache centers in Italy and shared a similar study design. The studies included both sexes, aged 18 to 65 years, with a current history of migraine with or without aura. The primary endpoint of the studies was the between-treatment comparison of patient preference, assessed by questionnaire at the end of the study. Secondary endpoints included numbers of pain-free at 2 hours, pain relief at 2 hours, pain-free at 24 hours, and recurrence of headache within 48 hours. Average preference scores did not differ significantly between the triptans in the 3 studies. In each individual study, similar efficacy was demonstrated between the 4 triptans in the immediate treatment of migraine, but there were lower recurrence rates and thus a better sustained pain relief with Frovatriptan. A pooled analysis of the 3 studies was subsequently conducted. Frovatriptan demonstrated significantly lower headache recurrence rates over 48 hours, 27% versus 40% with the comparators, indicating a more sustained pain-relieving effect on migraine symptoms. The lower recurrence rate with Frovatriptan may be explained by its longer elimination half-life versus the other triptans. Subgroup analysis of the 3 randomized crossover studies were carried out in women with menstrually related migraine, and the pooled analysis subsequently conducted. Similar proportion of pain relief and pain-free episodes were observed at 2, 4, and 24 hours for all 4 triptans. However, once again, Frovatriptan demonstrated lower headache recurrence rates over 24 hours, with 11% recurrence rate with Frovatriptan versus 24% with the comparators, and even more so over 48 hours, 15% with Frovatriptan versus 26% with the comparators. The non-steroidal anti-inflammatory drug, dexketoprofen, is a cyclooxygenase inhibitor which has a short half-life and reaches maximal plasma concentration after 30 minutes. Due to the differences in pharmacokinetic properties between Frovatriptan and dexketoprofen, the combination of these 2 agents may be particularly effective in migraine treatment, with dexketoprofen providing early pain relief, while the longer half-life of Frovatriptan reduces risk of recurrence within 48 hours. Efficacy of Frovatriptan plus dexketoprofen was compared with Frovatriptan monotherapy when administered early, less than 1 hour after symptom onset, or late, more than 1 hour after onset. As shown in the figure, the combination was more effective than monotherapy on pain-free activity at 2 hours, regardless of timing and dosing. Furthermore, late intake of Frovatriptan plus high-dose dexketoprofen proved efficient at managing the most severe and difficult attacks, with 95% pain relief at 2 hours and 100% at 4 hours with higher dose combination treatment. In conclusion, triptans remain the preferred treatment option of the majority of patients and physicians for the acute treatment of migraine. While a similar extent of initial migraine pain relief is afforded by Frovatriptan, rizatriptan, zolmitriptan, and almotriptan, the longer duration of action of Frovatriptan provides sustained efficacy and reduced relapse rate compared with the other triptans. Thank you for listening.